Stroke. What happens inside your brain? 3D medical animation breakdown. What you are about to see is one of the most dangerous medical emergencies affecting millions of people across North America and around the world. A stroke can happen in seconds. No warning, no pain at first, and yet inside the brain, an invisible chain reaction may already be starting. This is not just a medical event. This is a race against time. A brain stroke, also known as a cerebrovascular accident, happens when blood flow to part of the brain becomes interrupted or when a blood vessel suddenly ruptures. Your brain depends on oxygen every second. Even though it represents only a small percentage of body weight, it consumes massive amounts of energy. Brain cells cannot survive long without oxygen and nutrients. There are two major types of stroke. The first is an ischemic stroke, responsible for most stroke cases. This happens when a blood clot blocks an artery supplying the brain. Blood flow suddenly stops, starving neurons of oxygen. The second is a hemorrhagic stroke, where a blood vessel ruptures and bleeding occurs inside or around the brain. This can include ICH, known as intracerebral hemorrhage, or SAH, called subarachnoid hemorrhage. Inside the brain, pressure begins changing rapidly. As blood flow decreases, neurons begin to fail. Communication between brain cells slows down. Signals controlling movement, speech, memory, and awareness can suddenly become disrupted. This is why common stroke symptoms may appear so quickly. Sudden weakness on one side of the body. Difficulty speaking, confusion, loss of balance, blurred vision, severe headache. These are often the first signs of stroke, and immediate action can change survival outcomes. One of the biggest stroke risk factors is high blood pressure. Other risk factors include smoking, diabetes, obesity, heart disease, and poor cardiovascular health. Modern medicine has changed stroke treatment dramatically. For certain ischemic strokes, doctors may use clot-dissolving medication or perform mechanical thrombectomy stroke treatment, physically removing the clot from blocked brain vessels. Every minute matters, because during a stroke, millions of neurons may be affected. But the story does not always end there. Many stroke survivors experience recovery through rehabilitation and neuroplasticity, the brain's remarkable ability to reorganize and build new neural pathways. The human brain can adapt. The brain can learn. The brain can recover. This is the science of brain health, medicine, and human resilience. And this is what happens inside your brain during a stroke.